everyone. I welcome you all for Dr.Nimisha's Ph.D Viva Voce. Sir, I welcome Dr. Ramalingam sir, the senior most person. He was also there when I was teaching. Interesting topic. She is talking about the nexus between periodontal disease and the respiratory disease. She has taken two different topics. Like she is talking about, I think we are all aware about the pandemic, what we went through. And she is discussing about the pandemic and periodontal disease and the most common respiratory disease, COPD, and the link between that and periodontal disease. And to talk about Nimisha, she is my PG student as well. And she's showing the same sincerity like how she was there before. The same sincere effort she had put in for the last 4 years. And I'm very, very proud to have her as my student. And she's one of the role model students, we can say. And the forum is to you, Nimisha.
So good morning all. Today I am here to present my research on exploring the nexus between periodontitis and respiratory disease, a comparative evaluation of galectin-3 level in coronavirus disease 2019 patient and role of NETOSIS and microbial dysbiosis in chronic obstructive pulmonary disease patients with and without periodontitis. So these are the contents of my research work which I will be detailing further. So oral and systemic health are deeply interconnected, each shaping the other's balance. So the mouth often mirrors early signs of systemic disturbances. Recognizing this link strengthens diagnosis, prevention and comprehensive patient care. So is periodontal disease a risk factor for systemic condition? So what is chronic periodontitis? It's an infectious inflammatory disease which is caused by the bacteria of the plaque, resulting in the progressive destruction of the tissue. So recently there has been a resurgence of interest between the periodontal disease and respiratory disease. Why? Because there is an anatomical continuity between oral cavity and lungs, making oral cavity a reservoir for the colonization of respiratory pathogens. So coming to global disease burden, India accounts for around 32% of global burden of respiratory disease, out of which chronic obstructive pulmonary disease has got 384 million cases per year, and around 3 million people die every year, and it is considered as a third leading cause of death. Then second one, to examine and compare the salivary and serum galectin-3 level in periodontitis without the history of COVID-19 patients and in a post-COVID and periodontitis patient. So the third objective is to assess the prevalence of the respiratory pathogen Pseudomonas aeruginosa in the subgingival plaque of COPD with and without periodontitis patient. Fourth one, to investigate the presence of periopathogen, that is red complex bacteria and Fusobacterium nucleatum, again in the lung fluid that is called as bronchoalveolar lavage fluid, again in patients with COPD and with and without periodontitis. Fifth objective is to assess the salivary level of NETOSIS biomarker scintillated histone 3, again in COPD with and without periodontitis patient. And my sixth objective was to compare the effect of non-surgical periodontal therapy on pulmonary function, salivary scintillated histone 3 levels and respiratory pathogen burden in patients with periodontitis and those with both COPD and periodontitis. So my research included two prevalence study. First one is actually association between COVID-19 and periodontitis, which included two case control study. And second one is association between COPD and periodontal disease, which included 3 case control study and one interventional study where included non-surgical periodontal therapy in reducing the pathogen load and NETOSIS biomarker level in periodontitis and COPD with periodontitis patient. So sample size was calculated, then ethical clearance was obtained from the institutional ethical board, and then informed consent was obtained from all the patients. And moving on to my first module, that is association between COVID-19 and periodontitis, which had 2 case control study. First one analyzed salivary and serum galectin-3 level in COVID positive individuals with and without periodontitis, and second one which compared salivary and serum galectin-3 level post COVID periodontitis patient. So totally 120 patients were enrolled, out of which 4 were absent for the study and 2 declined to participate. So healthy controls, group 1 had 25 healthy control, group 2 25 periodontitis patient, group 3 23 COVID-19 patient, Group 4, 22 COVID-19 plus periodontitis patient, and Group 5 post COVID-19 plus periodontitis patients. So, all the respiratory patients, I mean COVID patients, were obtained from Lalithambika Medical College and Hospital during the period from Jan 22 to December 2023. So, once they turned RT-PCR negative, after taking a willingness to take part in the study, they were scheduled for periodontal examination. So, group 1 included healthy patients where there was no visual signs of gingival inflammation, no clinical attachment loss, and their serological test for anti-SARS-CoV-2 was negative. And group 2 also included periodontitis patient, and they also had serological test was negative. Group 3 included RT positive, PCR positive patient, but periodontally healthy. Group 4 included RT positive patient and with periodontitis. Post-COVID included moderate to severe COVID-19 cases who had moderate to severe COVID-19 cases, that is their oxygen saturation was less than 94 and they were hospitalized. Such patients were included in post-COVID group and they also had periodontitis. So, to conclude, periodontitis and respiratory disease share inflammatory and microbial pathway with galectin-3 emerging as a key biomarker linking COVID-19 severity, post-COVID complication and periodontal inflammation. Second one, the presence of periodontal pathogen in the lungs and presence of respiratory pathogen in the oral cavity with elevated NETOSIS marker in COPD patients with periodontitis highlighted a strong oral pulmonary connection. Then non-surgical periodontal therapy, it reduces the pathogen load, inflammation and improves the lung function, underscoring the importance of periodontal care in respiratory disease management. So, I would recommend to the public that we are all still living in the era of COVID-19. So, thus maintaining a healthy gums and treating periodontitis will definitely reduce the post-COVID complication. And just by doing a regular, very accessible period treatment, that is non-surgical periodontal therapy. And so, we dentists, especially periodontists, play a significant role in preventing respiratory disease by redoubling their effort to prevent periodontitis and to arrest its progression. So, these are my references. My work got published in both national and international journals. So I thank my sincere thanks to all the management team, that is Founder Chancellor Thiru A.C.S. Shanmugam sir, President A.C.S. Arun Kumar sir, Secretary Thiru A. Ravi Kumar sir, Vice Chancellor Dr. S. Geeta Lakshmi Madam, Registrar Dr. C.B. Palnivelu sir, and I also extend my sincere gratitude to Dr. A. Tirunavakarasu sir, Senior Director, Dr. S. Ramamurthy, Director, Dr. S. Bhaskar sir, Dean Research, Dr. Rajeshwari Hari, Additional Dean, and to entire research department team who helped me from the beginning till the end. And my deep gratitude to my beloved guide, Dr. Uma ma'am. Thanks ma'am, she was actually not only my guide but my mentor right from my postgraduate days. Thank you ma'am for always being there with me, for supporting me, for always constantly encouraging and motivating me, and also for a patient guidance ma'am throughout this research. Thank you ma'am. And thanks to Dr. Vijayalakshmi ma'am, who was my external expert. Ma'am with her friendly nature and her encouraging words always supported me. Thanks to Dr. Shankaram sir for always supporting me. Heartfelt thanks to Dr. Snowfia ma'am with her most friendly nature, with comforting words and kindness. Ma'am was always there to support me. And thanks to Dr. Lalita ma'am, she always motivated me as my PhD batchmate. Literally she pushed me in every step and thus to keep going in all the way. Then thanks to Dr. Gopal sir and Dr. Manoj sir for all constantly encouraging and supporting me. Thanks to Dr. Datri, who always actually motivated just by saying that just 2 more steps ma'am, just 1 more step, we'll just finish up, this is the last one. Thank you Datri. Thanks to special thanks and gratitude to Dr. Navina, my friend, who has always been my study support from the beginning and has helped me throughout from the beginning till the end. And also to Dr. Archana and Dr. Catherine, they have actually helped me whenever I needed the help, they helped me. And all my postgraduates who has helped me throughout, and all the non-teaching staff, especially Menaka sister, who helped me to take all the printouts for the day. And I also extend thanks to Dr. Shanmuga Priya. Ma'am could not come today. She is the associate professor from respiratory medicine. She was the person who helped me to take all the respiratory sample with full dedications. So I really thank her. Then also I thank the Savita Blue Lab and Biochemistry Lab to do all the analysis for the sample, and also Dr. Keshwan sir, who did all my statistical work. And I also thank my international examiner, Dr. Rameshbabu. He has come all the way from Andhra, and he has accepted to evaluate my research. Thank you, sir. And also my international examiner, Dr. Kameshri, who is from MST University, Malaysia. And also I extend my deep gratitude to my family, my father Mr. Mithradas and my mother Mrs. Sushma Mithradas, who are the true reason why I am standing here before you. And their sacrifices, their blessings and their support was always there for me throughout. And I am sure that my dad would be the most happiest person for me today. And unfortunately they could not come today here. And I also thank my sister Mrs. Nishita and my mother-in-law Mrs. Geeta Rajendran, who always supported and encouraged me. And also I take this opportunity to actually extend my gratitude to my husband Rajesh Rajendran, who actually was my pillar of support. And he always, he supported and motivated me throughout to overcome all the challenges which I face day to day during this research journey. And I also appreciate my son Aditya Rajesh, who is also, whatever sacrifices and understanding which he has done throughout the research is also appreciable. Then all my friends, I thank all my friends who have come today, Prasanna, Nisha, then Suresh sir, Vasudevan sir, who has spent their valuable time to support me today. And I thank even Nadeem sir, who has come today, Gayatri ma'am from Ortho Rajkumar sir, and Suganya ma'am, Sheila. I thank each and everyone who has come today to help me out today. And my humble and heartfelt gratitude to God the Almighty, who has always showered the blessings to me. Thank you. Thank you one and all.
It's a very good presentation, Nimisha. It's a very good scientific research topic selected. A very good data interpretation and also clinical relevance is very good, actually, interdisciplinary study. Those are very good informative. Just I would like some points to clarify from you.
Presentation.
Okay, very good presentation. As you defended everything, there's some queries and questions raised by whoever is present here. So I would highly recommend you to award of PhD from Dr. M.G.R. University.
I thank you all for joining. In the beginning, I went into the topic, so I just want to share a few words about Nimisha. She is one of the my best student, and I can say she is also a family friend of mine. But even though she'll never takes advantage, she knows she can get the things done. But she's to the core. She did everything by herself, and she went and collected all the samples, and it went as she had planned. And I would really suggest, my PG students are here, I just want them to take her as an example. She puts in her maximum effort and she gets the best of it, and one of the best good human being. And thank you all for joining us, Nadeem, Hari and Vijay from all our family people who are supporting her throughout. And special thanks to Rajesh. I think last 4 years he has really contributed so much. And thank you Ramangam sir for joining. Thank you so much. உங்களோட blessings நால தான் எல்லாமே நடக்கும். Thank you.